Hello again, everyone, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and on today's episode, I'm sitting down with Chantel Holz, the CNP from Monument Health Gastroenterology, to dig into one of the body's hardest working, but I think most often overlooked organs, and that is your liver. It's involved in everything from digestion to detox, and when it's not healthy, the effects can ripple through the entire body. Liver disease is on the rise, so this conversation is an important one for anyone thinking about long-term health. So, Chantel, thank you for coming in and doing this.
Thank you for having me.
I'm really looking forward to this one. I don't know why this is such a fascinating organ, but I probably know, because I will see the T-shirts around rally time that will say things like, "Don't worry, liver, you'll be fine." Mm-hmm. When you see those, how does that make you feel?
Job security.
Yeah. Oh, I suppose that's exactly what it could be.
Yeah, job security.
Well, let's just start out with, what the liver does and why is it such an important organ in our body?
The liver is one of the major organs. It has so many job descriptions, essentially. I mean, obviously detoxifying, which this day and age we're exposed to so many things, chemicals, things we put in our body, you name it. It also is a major transport and production center for cholesterol. It also produces bile. So it's got a lot of, important roles. Yeah.
For cholesterol? Mm-hmm. Really?
Yeah.
Now, I'm sure that's something that most people wouldn't be familiar with at all.
Yeah. So fatty liver is kind of one of the things that I really wanted to talk about because, well, that's the old term, fatty liver or non-alcoholic fatty liver disease. We're now calling it metabolic-associated liver disease. And I've been doing gastroenterology for over 10 years, specializing in liver disease. And I can't tell you over the past 10 years to see how much it's risen. And I think primarily because I think primary care now is doing such an amazing job with being able to identify risk factors and whatnot, we're seeing so much more of it. And what that is, it's like a metabolic associated dysfunction within the liver and fatty liver disease. And the reason why we're seeing so much more of it, well, number one is westernized countries. It's the number one cause of liver disease. We used to see hepatitis C, hepatitis B still, within not as advanced countries as the number one, but now fatty liver is surpassed. And we're seeing it now in 1 to every 3 to 1 to every 4 people. And the thing about the liver, the amazing thing about the liver is you can have absolutely no symptoms, even in advanced liver disease, no symptoms. When you become symptomatic of the liver, it's so far gone. So fatty liver, we're seeing so much of it because obesity rates, our diet, a lot of the processed foods.
So this isn't something that we're just learn. I mean, these are changes that we've unintentionally been doing to ourselves. This isn't something we've just studied more and now we see it more,
I think both.
Right? It is? Okay.
Both. Because, fatty liver, I've been involved in many clinical studies for fatty liver actually.
Right.
And we've learned so much more, I think, the past 6 to 7 years with fatty liver, given all these fatty liver clinical studies, because we are becoming more aware of it. Back in the day, I used to see patients come in, with end-stage liver disease, never touch a drop of alcohol, didn't know what happened. And then, you go back and you could see, well, you had fatty liver, and evidence of fatty liver ongoing. Mm-hmm. And now, since we're seeing so much of fatty liver, up to, 10 to 30% of people can develop scarring in their liver, and it even can cause cirrhosis. We think of cirrhosis with alcohol, as you mentioned that rally.
Right.
But people with significant cases of metabolic-associated liver disease can get scarring in their liver. And then if you combine that with moderate alcohol, lots of people consume alcohol, that just burns that liver out faster.
So is cirrhosis, is that the scarring? Is that what that means?
So cirrhosis equivalents to stage 4 liver disease, stage 4 scarring, end scarring. And then you have a normal liver, and then you have this in between, of different stages of fibrosis or scarring. So the thing with fatty liver is because, and it's a lot to do, there's risk factors involved with fatty liver. So yes, obesity, if your BMI is over 25, if you tend to carry your weight in your abdomen, the visceral fat, not the subcutaneous fat, it's the visceral fat in the organs, which some of us are genetically predisposed to. People with high triglycerides, one of the biggest risk factors is insulin resistance or type 2 diabetes. So we see a lot of that. Polycystic ovarian syndrome, high triglycerides, even women with polycystic ovarian syndrome, hypothyroidism. Metabolic issues are the ones that put you at risk for that metabolic associated liver disease. The fatty acids bog down in the liver, as we were discussing, that the liver has a major role for the cholesterol. That gets too overwhelmed and it bogs it down and it creates inflammation. And over time, it can cause it damage.
Okay. So I'll just give you an example here. So I do take an atorvastatin, okay, like 40 milligrams for genetic cholesterol. And just recently, I was at my primary care doctor and did, all the blood work and everything, and said, you have fatty liver. How serious do you have to take something like that? Because he never said like, no, it's not serious. I mean, some people can develop it, you can get it. When you hear something like that, what do you recommend?
The thing with fatty liver and doing this for so many years is, we used to think, if your liver enzymes are elevated, that's going to say, oh gosh, you're at risk to developing scarring. We now know that up to, I think it's up to 10 to 20% of patients. Actually, no, I take that back. They're even saying even upwards of 40% of patients can have normal liver enzymes and still develop scarring. So it's sneaky. Back in the day, we used to do liver biopsies if a person's liver enzymes were elevated for some time and we didn't know why. We don't really do that anymore. It's pretty invasive, high risk, it's expensive. And nowadays, we have non-invasive testing that screens patients to see if they're at risk or not. And so going back to your question, what I recommend, if you have been told that you have fatty liver, I also ask, mom and dad or family history, because I can't tell you how many patients I take care of that have end-stage liver disease, cirrhosis due to fatty liver, and now I'm taking care of their children, adult children. Because there are genetic susceptibilities to that. We now know that after doing all those clinical studies. So we have what's called a FibroScan. It's a non-invasive screening test, kind of like an ultrasound, but what it actually does is it sends a vibration through the liver and it measures how fast that vibration takes from point A to point B in the liver. And how fast it goes through the liver tissue, they can overall determine approximate the scarring or stiffness. And so it kind of gives us an idea of, geez, is this person at risk or not? Because nowadays we do have some more treatments than what we did 5 years ago. The GLP-1s, the Ozempic, the Mounjaro that a lot of people are on, those are helpful. And there's now an FDA-approved drug for fatty liver disease. And I was part of that clinical study. It's the first and only FDA-approved drug for fatty liver. We have to determine if there's scarring to get you covered, because that was part of the inclusion criteria with the clinical study. But the biggest thing is we don't want this to sneak up on patients and all of a sudden get slammed with the diagnosis of cirrhosis. And I mean, it's life-changing and it can be really, really bad, and we don't want that to sneak up on people, because now we can screen people and identify those people at high risk.
Well, so can you have fatty liver that doesn't damage anything?
Yes.
Okay.
Not everybody that gets fatty liver causes damage. No. And that's we don't know exactly, who's to say who's going to get scarring versus not. So, and that's the thing that we've learned over the years, because we used to think, only if your liver enzymes are elevated are you at risk. We now know that's not true. And some people, you can go back and see that their labs were completely normal for decades, and now they have cirrhosis with fatty, they had fatty liver with cirrhosis.
And so there's no outward signs of something like that it's happening?
Fatigue is discussed, but nowadays it's hard to say who's not fatigued. That's
really interesting. And I've heard this come up in conversations with doctors before on this podcast, fatigue being a sign of certain things. Is there a difference between being fatigued and just tired?
Exactly. It's hard. It's hard to determine because it's so subjective from every person. So fatigue is what they talk about with fatty liver. But a lot of times, going back to fatty liver, is you do have risk factors of, it might be obesity, high cholesterol, insulin resistance. So all of those can bring on fatigue as well. Now, in patients with end-stage liver disease, cirrhosis, those are significantly fatigued patients. I mean, those patients want to nap during the day. They're significantly fatigued. That's a different kind of a fatigue.
Yeah, all right.
It's life-changing. But yeah, they talk about fatigue. Or sometimes they also talk about a dull right upper quadrant sensation, sometimes with significant fatty infiltration, or when the liver is being stretched and it's enlarged, stretching that capsule, that can cause kind of like a dull ache. And patients they'll describe it as, it's just kind of there. It's not horribly painful. It's kind of like an awareness. It's not always it's not brought on by food. It's just there.
Right.
So that's another, vague symptom that people can have. Most patients don't have any symptoms.
Nothing at all. Okay. Well, it's of course the alcohol obviously of it plays a big part in this too. It seems to be we're learning more and more about alcohol. It used to be, a couple glasses of red wine might be good for you, or this might be okay. And now it seems like the more we read about it, the more any alcohol you drink is not good for you.
No, it's a toxin.
Right. And your liver, obviously, it's the first line of defense against a lot of that, isn't it?
Yes.
So when it comes to alcohol, what do you recommend when it comes to your liver? I mean,
the scary thing, I've been doing this for so long. I mean, it's hard. I mean, from my personal standpoint, liver's a toxin. It's like, why are we putting a toxin in our body? Do we promote smoking? No. Right. Is there any benefits to smoking? No. So I feel like society is kind of backwards on this whole thing. But it's a huge moneymaker, and everything's centralized around it. Yeah. The scary thing, again, if you walk into a bar, how many people are overweight?
Right.
Or how many people have fatty liver that don't know it? You take that in conjunction with even, two drinks a day. They say anywhere from 2 to 5 for a woman, 3 to 6 for a man, and that's daily average.
Right.
That causes a significant synergistic effect on the liver. So the scary thing that I see these young people with, you can look, most of these patients, you can see if they are at risk for metabolic liver disease. Not everybody, because some people have genetic susceptibility, but they have those risk factors. They don't know. A lot of young people don't go to the doctor because they feel they're invincible and they feel fine. So then they go on and they might consume alcohol on a routine basis, not the point of alcohol dependence, but just probably a little bit too much.
Right. And
they burn their liver out really fast. The youngest I ever had was a 25-year-old.
Oh, my.
Yeah, liver transplant. Yes.
Oof.
So it's scary when you see those things and you just don't know. And now even getting phone calls from pediatrics I'm seeing this young adolescents, why are their liver enzymes elevated? Well, they have high cholesterol, their BMI, all the risk factors. We're seeing these in young people now. So it's scary.
So what do people, if they're go to the doctor and the doctor says, look, we got to take this seriously right now. What are the first steps, or what does the process look like in order to, I don't know, I don't think you can cure this.
Well, it can be the great thing about it can be reversible.
Okay.
Is you can have the susceptibility to having this, but you can take action to help it. Mm-hmm. The biggest, and patients come in all the time, what liver detox can I buy? Don't do it, because it's so funny, because I remember none of that was on social media, and nowadays there's all of these liver detox things for fatty liver. I never would have seen that 10 years ago.
Right.
It's crazy. Don't waste your money. And just eat healthy.
Yeah.
Stay away from the processed foods. Stick with the outer aisles. Just go back to the basics.
Right.
The high fructose corn syrup, we are now knowing that is a significant synergistic effect with the liver, with fatty liver, that really bogs down the liver. So our country has allowed high fructose corn syrup in everything. Mm-hmm. And it's really causing a lot of issues.
Right.
And I truly I truly believe a lot of the processed foods is what's causing a big majority of this, because we're seeing all of these things so much more.
Right.
So I think diet, go back to just eating healthy and cut the crap out.
Yeah.
You know, that's just what I tell patients. Just take the junk food away. Get active. Get off the phone and start moving. Get off, people need to start being active. We're not as active as what we used to be. And the biggest thing is just knowing your family history, because if you have a risk, a family history of risk factors for fatty liver, know about those. Some people, unfortunately, no matter what they do, they just have a strong genetic predisposition, unfortunately. And sometimes the odds are against them, just like with heart disease, just like with diabetes, you name it, So, but now we do have tools to help them.
So are genetics what are the numbers there? I mean, is it something that's I think of something like a prostate cancer. If your dad has it, there's like a 50% chance that's going to be you're going to get it too.
I don't think
possibly.
we really know the numbers yet.
Okay.
I don't. I do know that throughout all those fatty liver studies that we did, we thought that there was genetic mutations maybe involved. By the end of it, I think we've identified 4 now. And it's not something that we typically get checked for. This was just something that we learned through clinical trials, that there are genetics involved. That's maybe why some people can drink as much as they want and their liver is fine and others can't. Genetics play a big role in it too.
Okay. Well, at what point then does a liver transplant become a necessity? I mean, how bad does it have to get down this road of scarring and cirrhosis before you're like, nope, you have to,
Yeah, that's a good question. Liver transplant, once your liver's shot, it's not like a kidney. You don't have another one to fall back on. It's one. You got one. Liver transplant is something that's considered if you have cirrhosis. There's 2 types of cirrhosis. So again, cirrhosis is stage 4 scarring. Your liver has been replaced by scar tissue all throughout. It's a lumpy, bumpy liver. It's nodular. There's 2 types of cirrhosis. I have patients that have cirrhosis and they have no symptoms. They had no idea they had it. They came to me. Their labs are normal. They had no idea. And it was incidentally found on imaging or whatnot. That's the scary thing. Then I have patients who have what's called decompensated cirrhosis. Now, going back to the compensated, what I forgot to hit on is you can have a cirrhotic liver and it can function fine. Believe it or not, it can still function fine. Then you get to the decompensated part of it where the liver, you have cirrhosis, but it's not functioning well. Those are the patients that have to think about transplant. Typically, the transplant, alcohol is the biggest driving one on the young patients. Right. With the fatty liver, I more so see it later on in life, not as young. But now, mind you, I've been to liver conferences where it's been discussed. I remember a doctor was talking about transplanting a 13-year-old girl. He showed us the picture of it, and it wasn't what you thought you would see. It was somebody who maybe their BMI was a little elevated, but nothing that stuck out, and he had to transplant her. I typically haven't seen that yet, but typically the patients that need transplantation from fatty liver are older and they have a lot more other comorbidities. Younger patients, it's a lot of driving, alcohol. Now, the other thing too with liver is, yes, those are the common things, but also there's lots of other things that can cause liver disease. There can be autoimmune liver disease. We know of autoimmune, we think of lupus, we think of rheumatoid arthritis, we think of inflammatory bowel disease. Well, there also can be autoimmune liver disease. Again, silent sometimes, and you can have more than one thing. You can have iron storage disorders, other genetic mutations, copper storage disorders. You can also have viral infections, going back to the viral hepatitis B and C. So I always, when a patient comes into me and they have risk factors for fatty liver because it's so common, I always check for other things. I can't tell you how many times I found more than one thing.
Oh, boy.
Yes, scary. I know, it's scary.
I mean, well, it seems like your liver also it seems like it's a pretty tough organ,
yes.
For what it has to do in your body. It's a little, I mean, hearing everything that can kind of happen, you're like, oh my goodness. But I mean, how worried should you be about that? I mean, if you're going to your doctor regularly and getting a checkup and getting your labs taken care of, Is that enough, or what more should you do?
I think the biggest thing, if you're healthy and you go to the doctor and you have your labs and everything's fine, great.
Right.
If you identify risk factors and you're aware of the risk factors, I think that considers looking into. We know the risk factors. Primary care providers do a great job of identifying risk factors. And so if there's risk factors involved, I think it's an easy way to just be screened, just so that we can identify and see who do we have to worry about, who do we need to follow.
Right.
What
does the screening look like then?
Typically, I use the FibroScan a lot, and I get a baseline imaging study, just like a basic ultrasound. I do check labs. Again, labs don't always tell us the whole story, but again, getting just kind of a baseline assessment.
Okay. Are there anything like on the horizon here that you're excited about? I know you mentioned that there's medication now that can do this. Is there other stuff down the road that that's not, hey, everybody get up and drink lemon water every day and you'll detox your liver?
What I'm excited about, because I've been saying this all along, this whole entire since I've been doing liver disease, is the processed foods, and I'm so excited that they're finally looking at it, to take these processed foods and start to regulate some of this stuff that we're consuming, being exposed to, because we have children that, our food supply, and this is just what we're giving them. So that is the biggest thing that I'm excited about. That, it's great that we're developing drugs and everything for weight loss, but I think it comes from the base, the bottom up, is our food supply, getting back to being healthy, just getting back to the basics.
Okay. And it's hard, right?
So hard.
It's
easier said than done. And
of course.
Totally.
Yeah. But it's something we, every doctor that we've got to talk to on this podcast, number one is always quit smoking. Obviously, that should be the first thing you do. It is taking those steps to, and it can be small steps. I don't think you have to jump right in immediately and throw out everything you've done.
No.
Just even mixing some things in to get started is good, isn't it?
Yes.
Okay.
And it's hard because everybody is so busy nowadays. We have parents that work, full-time jobs. We have kids in sports. And when you're on the go, you don't get to sit down to have a good meal. You're eating on the go all the time, and that part of that is, again, our society, but just trying to be more mindful and make better decisions.
So when you see things on social media, TikTok specifically is always one that pops up. Do you ever... I don't know if you scroll TikTok or if you're ever on it at all. Do you ever see some of these influencers that pop up and you're like, oh my God.
I
honestly
honestly
just come through the screen right now.
I don't get on TikTok much, but and I'm not a huge person on my phone, honestly. I'll be honest with you. But what kills me is these people trying to sell you supplements for your liver, because I can't tell you how many times I've had a patient walk in my clinic jaundice because of an herbal supplement that they're taking.
Really?
Yes.
What are some of the most dangerous ones?
Turmeric.
No kidding.
Yes.
Why is it so dangerous?
It was used for anti-inflammatory, is what the proponent was for it. But what they're finding when you're taking this is it can cause liver toxicity. I've seen quite a few drug-induced liver injuries from the turmeric. So if I see a patient with elevated liver enzymes, I'm like, get off the turmeric if you're on it. Yeah, the other thing going back to TikTok, let's talk about TikTok and everything. So we're seeing the anti-parasitic, the ivermectin. The ivermectins, and there is a few other ones. So I've had a few patients lately that we're doing the TikTok trend of these for anti-cancer or whatever the reason why they're doing the dewormers.
Right.
But they were, and some of them are they're not even approved for human usage. They're just like horse usage. And they've been taking, I took a lower dose than what was recommended on TikTok. Well, it's not studied in humans. We don't know it's safe, but I've seen quite a few patients with bad liver injuries with that. So that's the other thing I'd advise people to be careful of.
Well, then your liver's whole job is to remove to remove that stuff.
Yes.
That's what's, and so if you're adding more into it, the liver's like,
I know.
What the heck?
But it also can happen with antibiotics.
Right,
it can happen with lots of other things, but just we see all these trends going on, and so just be mindful of that stuff.
Okay.
It's not 100% either. So, yeah.
Right. And like you said, it goes back to eating healthy, and it's not easy to do. Sometimes it's a cost-effective thing too. It's easier to go get a combo from somewhere than it is to go to the
dollar
grocery
menu
store.
is great.
Of course,
I mean, it is so much easier said than done. I get it.
Well, this has been fun talking to you,
Yes.
Chantel. I really appreciate you coming in and doing this. And I hope down the road, especially when new advances come out or new things are learned about it. Although just saying that out loud, I'm thinking, well, we do know what you can do. We already know the steps you can take. We already know the things that can make it easier. But I think it may be more for the genetic side of things where you can't control it.
Exactly.
And, it is exciting to know that there is this medication that exists now that can give people some hope.
And at the last liver conference I went to, there was, I believe, 4 more GLP-1s coming down the pipelines with even additional liver benefits.
I'm really fascinated by that.
Yeah.
Because obviously the GLP-1s, the Ozempics, that kind of exploded on the scene. I mean, people with diabetes, obviously, I think knew about it for quite some time. But the weight loss thing now has kind of taken everything by storm. And I guess I hadn't heard the liver benefits from that. But you are discovering that with these.
Oh, yes, absolutely. I mean, it has been shown to help with fatty liver. Because it's kind of like you kill multiple birds with one stone as you get the weight loss benefit. And it's the visceral fat component. Again, that's why I do have some skinny patients with the metabolic associated liver disease. It's the visceral fat underneath that we don't see.
Right.
So it helps with that. It helps with the cholesterol. It helps with the insulin resistant component. And so when all of that, is treated, it helps with the fatty liver. So that has been really nice to see because I can't tell you, it's hard to see some of these patients with that lifelong struggle with weight, no matter what they do. And they've been heavy all their life. Their mom, their dad's heavy. And it's like they've tried all the things. And it is nice to finally see something helpful for them to live a good, healthy life as well. And so I think that's been it has been pretty neat to see that too.
Well, and I always encourage, because even with the GLP-1s, there are ways you can get them without going to a doctor.
Yes.
But go see your primary care doctor,
Yeah.
just make sure.
Yep.
Even though that it is exciting and it is positive, it's not something I don't think you should ever take if you're healthy.
No.
And you're just wanting to do it for
weight loss,
clout or whatever.
Yeah, because there's so many. I mean, all the social. That's another thing with the social media is all of that. So, you got to be careful with all that. There's a time and a place for everything, and it serves its purpose. So.
Perfect. Well, Chantel Holz, CNP with Monument Health. Thank you for coming in and
so
talking.
Much.
Yeah, this has been fun. Let's do it again.
All right.